Today we will be doing a video over the assessing the abdomen, musculoskeletal system, and the neurological system. Our participant here today, do you mind being recorded? Give us permission to record?
Yes.
Alright, so we'll begin our video. Can you start by telling me your first and your last name?
Tajay Cornegay.
Your birthday?
August 23rd, 2003.
Okay, so we're gonna start our assessment. We're gonna start by assessing your abdomen, then we'll move into assessing your musculoskeletal function and then your neurological function. So I'm gonna begin this exam by having you pull up your shirt, inspecting your skin. Then we'll listen to your bowel sounds in your abdomen. Then we'll go into percussion of your abdomen and then palpation of your abdomen. All right, we will begin with inspecting the color, the contour, the symmetrical appearance of the patient's abdomen, and the warmth and moisture of the patient's skin. So her color is normal based on her race. Her abdomen is midline. Her contour is flat. Her muscles are flat, which is normal. Her belly button is midline. No moles or lesions or bruising, which is Coiling sign, which would indicate like a intra or retroperitoneal hemorrhage, which none is present. Noted no peritonitis or pulsations in the patient's abdomen, which normally you don't normally see. And next we will begin by auscultating the patient's abdomen in all four quadrants, and then we'll auscultate for any like bruise, which we shouldn't normally hear. So we'll start by auscultation in the right lower quadrant. Now we'll auscultate for any bruise, and we'll start with the aortic location, the bilateral renal location, bilateral iliac locations, and then the bilateral femoral locations. So we'll start with the aortic location, which is just right above the belly button. Next, we move to the bilateral renal locations. And the iliac locations. And on the femoral location. Next, we'll move to percussion of the abdomen organs of the spleen and then the liver. And normally, if we noted any enlargement of the spleen, we wouldn't percuss that. But it doesn't seem like the spleen is enlarged, but we'll percuss because there's no indicated signs of that. Patient hasn't reported any pain or tenderness in that area. So we'll begin with percussion of the spleen. We find the end of the rib cage. Then we percuss. And then we'll move on to the liver. Starting up here in this region and percuss down. You know a difference in percussion sounds right here. So right here, so this will outline the border of the liver. So that concludes the percussion part of the abdomen. Next, we'll move on to palpation of the abdomen in all 4 quadrants, and then palpation of the liver and spleen. First, we will begin with light palpation in all four quadrants. Just let me know if you feel any pain or tenderness. Any pain or tenderness? So that was light palpation. Now we'll move on to deep palpation. Any pain or tenderness? Now we'll move on to palpation of the spleen and then palpation of the liver. Normally the spleen is not, normally you cannot palpate the spleen. So what I'm gonna have you to do is, before we begin, take some deep breaths and then release. So move on to that. All right, can you take a deep breath? And release. Okay. Now we'll palpate the spleen. Take a deep breath. Okay. Alright. So that concludes percussion and palpation of the abdomen. Alright, so next what we'll do is perform the liver scratch test, which is a test that is used to indicate like the liver size. And what I will do is have the patient to just relax, and I will place the diaphragm and my stethoscope at the end of the xiphoid process, and I will start with my finger in the right lower quadrant, moving up to the liver border. Alright, so that was the liver scratch test. For the last portion of our abdominal assessment, I will be demonstrating and explaining Murphy's sign, psoas sign, the obturator muscle test, and McBurney's point. So I will begin with demonstrating and explaining what Murphy's sign is. So what I would have the patient do is to take a deep breath, and I will place my fingers under the sternum border as she takes a deep breath, and I will apply just a little pressure. And if she feels pain in that area, that would indicate infection of the gallbladder, which is like cholecystitis. But the normal response is to feel no pain. So we'll begin with that. Alright, I'm gonna have you just take a deep breath. Any pain? Alright. So that's the normal response, but if she had pain, then that would be abnormal and mean that she had something going on with her gallbladder. Next, I will be performing the psoas sign. So for this test, I will have to be repositioning my camera. So 1 second. Alright, so for this test, the psoas sign test, what I will do is, patient is already in position. I'm going to place my hand on the patient's right knee and have her to lift her leg against my hand. And if she feels any pain in her right lower quadrant, that will indicate appendicitis. Alright, so you just raise your leg. Any pain felt? So no pain was felt, so that's a normal finding. So next test that we'll be performing is the Operator test, which is another test that could indicate appendicitis. So our patient is already in supine position. So what I'm gonna do is I'm gonna flex the patient's knee and hip to a 90-degree angle, and I'm gonna externally rotate the patient's hip, and if she feels pain in that right lower quadrant, then that will indicate appendicitis. Bring the hip up. And then we're gonna rotate it out. Any pain felt? No. So no pain was felt. So that's a normal finding. And lastly, the last test that we perform, the abdominal assessment, is the McBurry. We'll find McBurney's point, and I'll have to reposition my camera again. So McBurney's point, first you begin by finding the belly button, and in this area you'll find the anterior superior iliac spine, and you create an imaginary line between this area, and you feel for the location. And in between this line right here, you press down 2/3. If any pain is felt, that's an abnormal finding, and it will indicate appendicitis. Any pain? So that's a normal finding. So that concludes our abdominal portion of this assessment exam. So next we'll move on to the musculoskeletal system. All right, for this next portion of this assessment, we will be assessing the patient's musculoskeletal system. So first we will begin with inspection of the skin, assessing the color, the joints, any redness, tenderness, any pain, nodules, the alignment of her posture, symmetrical on both sides. So as you can see, the patient posture is upright, symmetrical. She's in the right position. Noted no deformities or anything like that. The skin, straighten your legs out. Her joints, no redness, any tenderness anywhere, any pain. Moisture, her skin is moist, no dryness noted. Skin elasticity and turgor is less than 3 seconds. Snaps back as it's supposed to. Let's see. And her lower extremities noted no bulging veins, so that's normal. No redness. No redness, like I said, no thermia, no crepices. So you could just note it. And while we're doing this is flexion and extension of her knee. Noted no crackling sounds, no pain. It's symmetrical on both sides, so that's the range of motion of her knee right there. Next, we will assess for her capillary refill in the upper part of her extremities, and then we'll move on to the lower part of her extremities. Make sure she's getting good perfusion. And the patient has nails, so it's kind of hard to detect capillary refill with nails. So we just use your fingers. And just apply a little pressure, and they all seem to blanch back less than 3 seconds. I'm gonna adjust the camera, and we'll assess the capillary refill of her lower extremities as well. And just take off your shoes, and then let's adjust that. It's a little cold, but the capillary refill normal. And while we're already down here and we got our camera position, we're gonna next palpate for her pulses and her lower extremity. So we'll begin assessing the dorsal pedis pulses, which you can find located in this area from the big toe, between the big toe. Regular rate, her rhythm is regular, +2 pulses felt. Same on this side. +2 bilateral pulses felt. Rate, what I would consider regular. No irregular rate or rhythm. All right, next we'll move on to the posterior tibial pulses, which you can find on the lateral inside aspect of the patient's lower extremity or ankle area. So in this location here. And normally you would palpate for a whole 60 seconds if you noted any irregular rhythm or rate, but her rate and rhythm is regular and normal, +2 bilateral pulses noted. And so next we will move on to assessing the upper extremity pulses, which is what you can find. We'll start with the brachial and then we'll move to the radial. So this right here is the brachial pulses. +2 bilateral pulses, regular rate. Let's move on to the radial. Rate and rhythm normal, +2 for the rating scale. So now that we have assessed the patient's, palpated the patient's pulses, her capillary refill, inspected her skin, determined her posture. Now, next we move on to range of motion. We already tested the range of motion in the patient's bilateral knees with flexion and extension. So next we'll move on to the patient's shoulder range of motion. Then we'll do her legs, her hips, and go from there. So we'll begin by performing what is called the Abdominal test, which tests shoulder range of motion. That test can detect abduction, adduction, external rotation, and internal rotation of the shoulders. So what I'm gonna have the patient to do is stand up, and the test also can detect flexion and extension of the shoulders. And I'm gonna adjust again, just a little bit. All right, I'm gonna have you to stand up, and I'm gonna have you to do this. Well, not yet. Do this with this, and then you're gonna do the same thing. The same thing with your other hand. Turn around. Okay, this one. All right. Okay. All right. So that's the aptitude test, and as you can see, it was symmetrical on both sides. The patient was able to touch both of her hands. She was able to flex and extend her shoulders behind her back. So that was flexion and extension. External and internal rotation was demonstrated. And while the patient is also standing up, what we're going to do is do hyperextension of the shoulders. So if you can just move both of your shoulders back. This is displaying hyperextension of the shoulders and pain or anything. And then next, I'm gonna have circumduction of the shoulders. So what you do is just rotate your arms back like both of your shoulders. So you can stay like this. Both of your shoulders back like in a circular motion like a windmill. Any pain or anything, no? Alright. So that concludes range of motion of the shoulder. While we already have our patient in standing position, we can go ahead and assess for range of motion of the patient's spine. So when you turn to the side, or just turn your whole body to the side, like your feet and everything. And then I'm gonna have you to bend forward. Bend forward, the way like you're about to touch your toes. This is flexion of the spine. You can stand back up and then backward just a little bit. This is extension of the spine. Just a bit. And then lean back a little more. This is hyperextension of the spine. Alright, and then you can turn back forward. We're going to do range of motion of the spine as well with lateral bending. So you can just turn to your right. Alright, and then to your left. Alright. So that was lateral bending of the spine. And also, while the patient's we're assessing the spine, we can assess for scoliosis. So what we would do is to face that way again. And I will have the patient to bend forward again. Before you bend forward, do you mind if we lift up your shirt a little bit, like maybe over your shoulders or something like that. That way we can see the alignment of the patient's spine. And we're going to have you take off your shirt briefly, and we'll just let you take off your shirt. That's good, just a bit. And we're going to have you to bend forward, and we'll assess for any deformities or abnormalities of the spine. And as you can see, I'm standing behind the patient so I can view her spine midline. The spine is midline, does not deviate to one side. You can stand like up. So that's how a quick way to assess for scoliosis, which I know no deformity, so I would say the patient doesn't have scoliosis. So now we'll do range of motion of the elbows, starting with flexion. You can bring your elbow to you, and the other, and then keep it flex, both of them flex. This is flexion, and then when you extend them back out, that's the extension of the elbows, and they're equal. No abnormal findings or difficulties in when she did both of those movements. So next we will do test sublation and pronation of the elbows. So you can just relax, and then your palms will be up. It's considered sublation, and then turn your hands down like that. That's pronation. Equal and symmetric. Alright, next we will test range of motion of the wrist. So what I'm gonna have the patient to do is just move her wrists, both of her, starting with the left hand, move your wrists up and down. This is considered flexion and extension of the wrist. Same with that one. Alright, and if you can move your wrists kind of back all the way. That's hyperextension. Same with that one. And then if you can just rotate your wrist. And this is considered rotation of the wrist. And then we're gonna test lunar deviation and radial deviation. So what I'm gonna have you do is to move your hands in like that, roll your wrist in like that, and back and forth. Let's test the lunar and radial deviation of the wrist. Same with that. Alright. So that concludes the range of motion of the wrist. Next we'll move to range of motion of the fingers. So what I'm gonna have you do is to make a fist. Both you can use both fingers, both hands. This is flexion of the fingers, and then just open. This is extension of the fingers. Spread both of your fingers apart. That is abduction of the fingers. Put them back together. It is adduction of the fingers. So that includes range of motion of the fingers, but we're going to identify what is called the snuff box, which is a small triangular deviation located between the radial gums. So let's move this a little closer. Let's see. So just open your fingers a little bit. So it's kind of like a triangular rotation or deviation. So the snuff box will be located right here in this area, and in this area, and then you can identify this deviation located right there in that area. So that's the snuff box. Alright, so next part of the testing the range of motion, we'll have the patient to lie back down in supine position, and we'll do range of motion of her hip. So let's adjust our camera. Alright, so now we have our patient position, supine position. So we're going to be doing the assessing the range of motion of the hip. So let's see. Well, before we spread the patient's legs apart, we're going to do assess for abduction and adduction and abduction. So when the legs are together, this is adduction. So if you could move them apart, this is abduction. This is adduction. If you can do it for me, put your legs apart and then together. Yes. So now we'll do assess for internal rotation and external rotation of the hips. So what I'm gonna do is just relax and just turn the hip area. Any pain?
No.
Same this way. Any pain?
No.
Now we'll do flexion of both extremities. Flex the patient's hip. Flexion. Which I should back up just a little bit, just a tad. Okay. Same with the other leg. Flexion and extension. Alright. And then next we'll do hyperextension of the hips. So if you could lay on your stomach. And move her legs up. Just relax. Relax. This is hyperextension of the hip. Any pain?
No.
Alright, and now we'll move on to range of motion of the ankle. We assisted the patient's range of motion earlier when she was sitting upright. So now we'll move on to range of motion of the ankle. And with that, we will be having the patient, we'll be checking for plantar flexion, dorsal flexion, inversion, exversion, and also rotation. So we'll start with dorsiflexion of the ankle. And flex the patient's foot up. No pain or tenderness or sounds noted. And then plantar flexion is when the foot is pointed down. No resistance noted. And then we'll do inversion. exversion, inversion, exversion, inversion, exversion. Inversion is in toward the midline, exversion is out toward the midline. And then rotation of the ankles. No resistance there. The ankle rotates beautifully. Same with this extremity. So that concludes range of motion of the ankle. Alright, so for the next part of our musculoskeletal system, we'll assess the strength of the patient's neck, shoulders, and all that stuff. And so we're going to assess the strength of starting with her neck. So what I'm gonna have you to do is to deflection and extension of your neck. So I'm gonna have you to bend your head to your chest, and then try to lift your head up. Okay. Alright. And then tilt your head back. And then try to lift your head up. Alright. Good. Now we'll do a test shoulder strength, so you can bring your arms out. And try to bring them back down. Okay. Now up. And then try to lift them up. Okay. That's good bilateral strength on both sides of her shoulders. Now we'll do strength of the elbows. So try to bring your arm down. Okay. Bring your arm down. Okay. Alright. So just lift your arm. Now try to bring your arm down. That was assessing the strength of her elbows. Now we'll assess bilateral hand grip strength. So just squeeze your hands. Alright, equally strong. Now we'll move on to assessing the strength of the knee with the flexion and extension. So straighten out your legs for me. Alright, let's see. We'll start with this leg. Just lift this leg. Keep it straight and hold it up. And try to push it down. Good. Same with the other one. Lift it up. Down. Good. No drifting. Now flexion. Alright. Try to push it outward. Good. You can just alright. Try to push it outward. Push your leg. Good. Now we'll assess the ankle with plantar flexion and dorsiflexion. So I'm gonna have you lift your foot up. And just keep it up and try to resist. Good. Alright. And I'm going to put your foot down. We'll do this one. Just try to put it down. And then apply pressure and try to release. Okay. Same with this one. Alright, good. So that concludes the strength test of the musculoskeletal system. Now we'll move into specialty test of the musculoskeletal system. So since we have our patient already in sitting position, we'll start with the Sterling's test. So what I have the patient do is to the Sterling test. what we're trying to do is recreate the feeling of like pain that the patient may have felt. So what I have the patient to do is to look up, hold your head as far back as it can go, and put your ear to this shoulder. Any pain felt?
Mm-mm.
We'll keep it there. No pain?
No.
So apply a little pressure. Any pain?
No.
Okay. Alright, keep it there. Now do the same thing with the opposite arm, but first look up. And then tilt your head to this side. Any pain?
No.
Keep it there. Okay. And any pain?
No.
Alright. So that's the Sterling's test. So next we move on, since the patient is still in position, sitting position, we'll move on to the next test. So another test that you can perform while the patient is in sitting position to assess for carpal tunnel syndrome is the Tinal test and then the Phalen's test. So with the we'll start with the Phalen's test. This is the Phalen's test, the test for carpal tunnel syndrome, and normally you have the patient to hold this position for 60 seconds, but usually before then they might feel the sensation of burning or tingling. Do you feel that? And if they did, then that would indicate the presence of carpal tunnel syndrome. And the next test that we'll use to assess for carpal tunnel syndrome is the Tinal test. So what we'll do is move this up right here. Have the patient get this super tight. Flex your wrist, yeah. Like that. So what you do is you'll find the medial nerve and kind of spin like, yeah, that's good. And we'll just percuss to try to generate the sensation of any like pain, numbness, or tingling. Feel anything? And then we'll do the same with the other wrist. Kind of the same. Medial nerve by percussing. Pain, tenderness. Alright, so that's a normal finding. We don't want no pain or tenderness. So those are the two tests that you, specialty tests that you test for carpal tunnel syndrome. With this test, I'm going to have the patient to do this, the same thing on both sides. Kind of have the patient to make a fist, put your thumb up like a hard fist, and kind of let that, let this wrist hang over like that. Just kind of move in and make a fist. You got a fist? Alright. Any pain felt? What about, and then kind of bend thumb down. Any pain? Probably pressure. Pain. So that's the Frankenstein test. No pain was displayed, so that's a normal finding. We try to recreate the symptoms that the patient may have felt, but she didn't feel any pain, so that's a normal finding. So that's a normal finding. Patient felt no pain. So what I'm gonna have the patient do is now make a fist and put your thumb inside, like this. Let it hang over and put it down. Any pain?
No.
Pain?
No.
Alright, and do the same with this other hand. Okay. Turn that way a little bit. And let that hang over. You got a fist. Alright, and any pain?
No.
Pain?
No.
Alright, now make a fist with your thumb inside. Let it hang over. Pain?
No.
Pain?
No.
So that's the Frankenstein's test. So that's the specialty test that you perform, that the patient can perform while she's in sitting position. So next we'll move on to the tests, like the arm drop test, empty can test, full can test. We can have the patient to perform that while she's standing up. So now we have our patient in standing position. So now we'll perform what's called the arm drop test. So we'll have you extend both of your arms, rotate a little bit, and turn it 90 degree angle. And hold it there. Adjust our camera. This is the tag. Ready? Put this in tag. Let's see if I can put the patient just a little bit more. Alright, thumbs up. And holding, no thumbs up. Keep your thumbs up. And hold them like this. And hold them. Alright, notice no drop in the patient's arm. So this is, and her thumbs are up. So this is what you call the perform the arm drop test. At the same time perform the full can test. Now do the same thing with your thumbs turned down and raise your arms a little bit. And this is the empty can test. No arm drop. So that's a normal sign because we don't want no arm drop. So you can relax. So next we'll perform also while the patient is in standing position is the Hawkins test. Next we'll perform while the patient is also in standing position is what's called the Hawkins test. So we have the patient extend her arms at a 90-degree angle and rotate internally. Support the arm. Try to exhibit some pain. Okay. Everything this arm. Rotate again internally. Everything. Alright, so that's the Hawkins test. So our next test we'll perform is with the patient in supine position. Alright, we got our patient in supine position, so we'll start with doing the straight leg test. So what I'll do is raise the patient's leg to as high as it can go to see if it generates pain. And then, next I'll flex the patient's foot into dorsiflexion. So, we'll start with this leg. Okay. This leg. You can see. Pain?
No.
Pain?
No.
Okay. We'll do the same other leg. Pain?
No.
Pain?
No.
That's the straight leg test to try to generate the same feeling like of pain, but the patient may have pain, so it's a good finding. Next we'll move into assessing for fluid of the knees. So we'll do the bulge test and the balliment test. We'll reposition our camera. One sec. Alright, so now we have our camera position. These are the two specialty tests that you perform to assess for fluid in the knee joint area. We'll start with the balliment test. So what you do is go above the knee, a little bit below the knee, in this area right here. Push the knee together, fluid together. If fluid was present in the knee, you would compress it down and you will feel it. So now you know it. And then you'll do the same on the other extremity. Press inward of the knee joint. And press. No fluid node are present. That's the Abdominal test. The next test is called the bulge test. So what you would do with this test is you will go in on the side of the knee and shift the fluid to the other side, and you will notice the presence of fluid on the other side by shifting it laterally to the opposite side. But as you can see, in this case, no fluid noted. So then you'll do the same on the other extremity by shifting the fluid to the side, and as you can see, none noted on this knee. So those are the two specialty tests that you will perform for to assess fluid in the knee joint. Alright, so the next test that we perform is called the McMurray's test. So what we will have the patient do is just to completely relax, focus on breathing, completely relax. So what we'll do next is we'll start with this extremity. So we'll have our hand to support the ankle, one support the knee, and then we'll place one finger right here, one finger right here. Flex this leg like this, back and forth. And as we flex it, we'll kind of like externally and internally rotate the leg to see if it generates pain. Does it hurt or anything?
No.
So we'll do the same thing with this. Support the ankle, the knee, one hand on the medial joint and the lateral joint. Flex the leg. And then externally rotate. And that's the McMurray's test. So now we'll move on to our next specialty test. Alright, the next test we'll perform is the anterior and posterior draw test. And this is assessing for any like ACL tear. And what you should do as we're moving the tibia forward or backward, normally if there is no tear, you won't feel no tibial movement. So what you have the patient do is you flex their leg kind of like that. We'll sit on their foot to kind of stabilize it. And then we're gonna have our thumbs on the patient's knee area. If I can, let's see, move this a little closer. Thumbs in this area right here, index finger behind the knee to stabilize the hamstring. And what we'll do is pull that tibia towards us, and what you should feel is no movement. And then that's called the pulling it towards us is the anterior draw test. Next, the posterior draw test is the same concept. Thumbs, index finger, sitting on the patient's foot. Push it, pull it back, and you should feel no movement. So we'll do the same thing with the other extremity. We just have to switch let's see, switch positions. Yes, I'm gonna have the patient to turn 1 second. All right, so now we have, this is the patient in position. Now we'll perform the same exact test on the patient's other leg to assess for ACL tear. Flex the leg, sit on the patient's foot, thumb in this area, index fingers behind the hamstring to stabilize the hamstring. Pull the tibia towards us, no movement. The anterior draw test. Now the posterior, no movement. So this test was the anterior and posterior draw test. Alright, so next is the Lockman's test. So what you're gonna do is to put your hand right here to stabilize the femur. Put your other hand right there. And what you're gonna try to do is pull the tibia forward. And normally the tibia wouldn't move. So what we're gonna do the same thing with the other extremity. And right here to stabilize the femur. And then just right below the kneecap. And pulling that tibia forward. But let's adjust the camera and see if y'all can see. Yep. Try to pull that tibia forward. And that's the Lockman's test. Alright, next test we'll assess is the valgus and the various. The valgus assesses the MCL, the medial joint vein, knee vein and knee joint vein. And the varus assesses the LCL, which is the lateral knee joint vein. So we'll start with the valgus joint vein. So what we'll do with that one is begin with pressing in on the lateral aspect of the kneecap a few times. And we're gonna flex this patient's leg and then kind of stabilize it at the ankle area. And press in. And this is the valgus. You're trying to assess the medial joint line, and what you would see is bulging on this side by pressing in on the lateral aspect. And since we're already doing this extremity, we'll also assess the various, which is assessing, like we said, the LCL. So what you do the same thing on the other side by pressing in a couple of times on the medial joint nerve. Stabilizing knee. And as you see no bulging on this side. So now we'll do the same thing. Valgus, lateral aspect, stabilize the leg, press it in, no bulging. Varus, medial, stabilize. We're gonna have in order to see this side, we'll have to have the patient turn for us. If you don't mind, turn to this side. We'll actually turn this way for me. That way you can see. And then you relax that leg, relax, flex, stabilizing. And as you can see, no bulging on this side. So that was the valgus and varus specialty test. All right, now we'll move on to the neuro, the last part of our assessment, the neuro evaluation. All right, so we will begin by first assessing our patients, just overall memory, mood, affect, abstract, and judgment. So we'll start with assessing the patient's memory. Can you tell me your name?
Taja Cornegay.
Your date of birth?
August 23rd, 2003.
Do you know what today's date is?
March 10th.
Who's the president?
Trump.
Okay, so all those is correct. So I would say the memory cognition is intact. Next, we'll assess her mood and affect. So we've been assessing her this whole time. So haven't noticed anything abnormal, but you can ask the patient, how are you feeling today? So how are you feeling today?
All right today.
Okay, so any feelings of sadness, depression, happy?
No.
Okay. Are you depressed?
No.
Any happiness, anything you got to look forward to?
Not at this moment.
Okay. So our patient's mood, we wouldn't say she's depressed. We haven't noticed any sadness. She has been very cooperative throughout our whole assessment. So we would say her mood is considered appropriate for the patient and her affect. She hasn't been crying or acting outrageous or anything. Next, we will assess the patient's judgment and abstract. So what we can do by this is just asking the patient, you know, like, just say if you found like a random wallet on the street, what would you do with it?
Pick it up and take it to the police station.
Okay, so for most people, that would be, you know, the appropriate thing to do. So I'm gonna name a couple, and then that was her judgment, assessing, you know, like her judgment. So next we'll assess the abstraction. So what I will do is, you know, just ask the patient to, I'll name out a couple of fruit, and I'll have her to tell me what their normal color would be. So we'll start by I'm gonna name a few. I'm gonna have you to tell me what the color of a banana is. The color of a plum. The color of a sour apple, and the color of a sweet apple. So we'll start by banana.
Yellow.
Sweet apple.
Red.
Sour apple.
Green.
And a plum.
Purple.
Yes, so all those answers was correct. So we'll say her abstraction is normal. And in our next part of our neuro assessment, we will begin by assessing the patient's reflexes. So we will get our reflex kit out. And we will assess the patient's her upper extremities, start with her biceps, triceps, and brachial radialis reflex tendencies on both extremities. So what I'm gonna have you to do is just relax, completely just relax, act like your arms is dead, and then we'll find, you know, the brachial reflex. And what you should see with the brachial reflex is flexion. Alright, so as you can see, there's flexion of that hand, so it'll be the same on this hand. Find another brachial alright. So that was the biceps. Now we'll move to the triceps. So next we'll assess the patient's tricep reflex. So we'll act like this leg is, this arm is dead in that. So bring it out. We gotta break this up some more. Yep. Okay. No. Relax. Yep. Okay, we're gonna do the same thing on this side. Just relax. Okay. So that was the triceps. So now we'll assist the brachial radialis reflex. And what you should see with this one, with the triceps, you should have seen extension. And with this reflex, you should see like just a little jumping of the fingers, just a tad bit. So, let me bring it closer. There we go. Okay. So this one. Okay. So that's the brachial radialis reflex. So that's assessing the reflexes of the upper extremities. So now we'll move on to the reflexes of the lower extremities. So we'll start with the knee. So now we'll assess the patella reflex. So we find, you know, the knee bone. Okay, so we jump into the leg. We do the same with this one. Okay, now we'll move on to the Achilles and the Babinskis and the collar. All right, so next we'll assess the Achilles reflex. So kind of lightly just hold the feet. And okay, and then what you see is plantar. Normal response is plantar flexion of the toes, especially at the great toe. You don't see dorsal flexion because that should be disappeared by the age of 2. So same thing. Hold the feet lightly. Okay, so that's the Achilles. All right, next we'll do the Babinski. So just adjust this. And we'll hold up the foot. And we should see the same response, like plantar flexion of the big toe. So just hold the foot like that. Starting with this. And starting in the palm of our foot. And see the little great toe just go down the tag, and that's the one spot. And then the same thing with this one. Alright, so that's that one. Alright, next we'll perform the Clarence test. So what you'll do is just have the patient to just relax and kind of just relax. And just kind of wiggle the feet just a little bit to get the patient relaxed. And then dorsiflex the foot, and abnormal response will be continuously jerking, or the feeling of jerking in her lower extremities, which I didn't feel on this side. So we'll do the same on the other side. And just, relax the foot a little bit. Dorsiflexion of the foot. No jerking in this extremity neither. So that includes the reflex test of the lower and upper extremities, with a deep tendon reflex test. So now we'll assess for the patient's sense of position and vibration. So what I'm gonna have the patient do is to close her eyes. Alright, and close your eyes and you just throw your feet down, just let your feet dangle. So I'm gonna have you close your eyes, and I want you to tell me which way I'm moving your toe up or down. Just keep your eyes closed, okay? Oh, wait 1 second. Okay. Up.
Down. Up. Up. Down.
All right. So her we'll say her sense of position is normal, and now we'll assess for bilateral equal vibration sense. Alright, so now we'll test vibration sensation using our tuning fork. So I'm gonna have the patient to put your palms down and everything on the thighs. So you just tell me what you feel, okay? Feel that?
Yes, tingling.
Feel that?
Yes.
Feel the same?
Yes.
On both sides? Alright. Do the same thing for her lower extremes. Feel that?
Yes, tingling.
Feel that?
Yes.
Feel the same?
Yes.
Alright. So her vibration sense we would say is normal. So I will assess for light touch and sharp touch in the upper extremities and the lower extremities. Alright, so I'm gonna have you close your eyes. Okay, so the patient's got her eyes closed, so we'll assess for light and sharp sensation. Alright, I'm gonna have you just tell me if it's sharp, what do you feel? If it's sharper, it's light.
Light.
Sharp. Sharp. Sharp.
Light.
Okay. Alright, and then I'm just gonna have you tell me if it's getting sharper, duller, or what.
Feels the same. Feels the same.
Okay. Keep your eyes closed. Alright, it's just stand out your feet. And you tell me if it's just tell me what you feel.
So sharp. 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 Soft. Soft.
Alright, so we would conclude from this that the patient's sensation is normal on both bilateral and low both bilateral upper and lower extremity. So so now we will assess for stereogopinus and graphivia, and we'll do the 2-point discrimination test. So we'll start with stereogopinus. So what I'm gonna have you to do is I'm gonna have you close your eyes again, and then I'm gonna have you to identify with your eyes closed what object is placed in your hand. Okay, so open your hands. Close it. What you think is in that hand?
A measurement thing.
Yes. Alright, what about in this hand?
Scissors.
Yes. So we would say that test is normal. Patient is able to identify objects correctly. Next we'll do the graphisia test. So what I'm gonna have you do is to keep your eyes closed, and I'm gonna draw something in your hand, maybe like a number or a letter, and you tell me what you think that number or letter is made out to be, okay? So what do you think that is?
Oh.
Correct. Alright. What do you think that is?
B.
One more time.
A 8.
Yes. It's an 8. Alright, so we'll say that graphisia test is normal. So next, what we'll have the patient do is we'll test the 2-point discrimination test. So next we'll do what's called the 2-point discrimination test. So what I'll do is move this closer. And I want you to close your eyes, and I want you to tell me if I'm touching the tip of your fingers with 1 or 2 points. So we have this little device right here. Two, 1, 1, 2, 2, 1. All right, so we can conclude from that test that our patients no abnormal findings noted. So next we'll move on to the serial nose pointing finger test. So what I have the patient to do is to touch her nose, then touch my finger in that motion, okay? So first we'll start by touching right here and touch your nose. You want to just do this. So as you can see, we know that no overshooting of the finger, no abnormal findings. And next what we'll do is that the rapid hand patting test is test the patient's coordination. And that finger nose testing is also testing the patient's coordination. So what I'm gonna have you do is just rapidly like do that. A little faster. Alright, so we know that symmetrical movements and hand and movement and speed. So next we'll do the what's called the pronator drift test, and we can do it at the same time as we do the Rumberg's test. So I'm gonna have the patient to do is to stand up, and we'll just camera back. Move the camera back. So we'll have the patient. We're testing 2 tests at one time. So what I'm gonna have you to do is hold your arms up. No, you stay straight. Stay facing straight. And have your arms up like this. And I'm gonna have you to close your eyes and hold it. And what we're looking for is no drift in her arm and no loss of balance. So we stand close and on lips, because a positive pronator drift test her arm will drift down. She won't be able to hold it. And then a positive Rumberg's test is she would fall and lose balance with her eyes closed. But we know that none of that, so both of those tests are negative, so those are considered normal findings for this patient. All right, next what we'll also assess for is what you call foot tapping and the heel to shin test. So what I'm gonna have you to do, and we'll start with the heel to shin test, is basically just do this with both foot down the chin. That way normally noted. And then foot tapping is just basically like tapping your foot, or just up and down, like as fast as you can. Okay, so that's good. So now all that was normal. So now what we'll do is we'll adjust the camera and we'll assess the patient's gait. All right, so we're gonna have our patient to stand, and we're just gonna have her to walk towards us and walk back that other way, and we're just assessing normal gait walking, like no loss of balance or any of that. So you can stand and walk towards me. And you can see her legs are moving as well as her arms. Turn around and walk the other way. No loss of balance. So now what I have you to do also is to come back, walk towards me, and walk on your toes if you can. Yep, and yep. Up. Walk back up just a tad when we do that, so they can see. Back up some more. Alright, and then walk towards me again. On your toes. Now walk on your heels. Facing the other way. You can walk that other way on your heels. Okay, equal, coordinated movement. Walk on toes and heels. And the last thing that we'll assess is tandem walking, which is basically what I want you to do is just walk. Like you're walking on a straight line. Foot in front of heel. And as you can see, you noted no loss of balance. None of that note. Alright. So that concludes the end of our video assessing the patient's neurological system, musculoskeletal system, and assessing the patient's abdomen. I thank you for being a participant today. Thank you. Hope you enjoy the video.